Stress is a physiological situation in which any man or woman respond to an environmental change or metabolic change. This meeting wants to understand if when we have a pathological stressful situation interferes with the reproductive function. And the discussion today was completely devoted to understand what are the mechanisms through which stress has an impact on reproductive function in men and women. Several of those disorders may be physical, like endometriosis or fibroids, uterine fibroids. Some of these disorders may have an hypothalamic source, like amenorrhea, infertility, and chronic anovulation. The second question of the discussion was, when we have an infertility situation as consequence of any reproductive imbalance, is stress a dangerous consequence? And this, again, we have a positive answer in this question, because all the studies interviewing infertile couples, women undergoing to assisted reproductive technology, they show to have high stress levels. So in this case, this will never help the couples to become fertile. So now we have two targets in our clinical practice. One is to reduce the stress in infertile disorders in order to reduce the number of disorders, and secondly, to try to reduce the chronic stress in those patients who realize to be infertile and undergo to hormonal treatments or assisted reproductive technology in order to have a successful pregnancy. So in medicine, as gynecologists, as reproductive medicine, we have to learn that this word, stress, is an underlying danger problem which comes first and comes after. So we'll never lose. Even at the end of pregnancy, for example, when you have a good infertility success and you become pregnancy, those women who had stress can delivery preterm. So the story will never finish and is a continuous. So to fight against a chronic stress situation is really very helpful for reproductive medicine experts.